In tonight's Health Center, we want to take a look at the impact the pandemic and the isolation in the last year is having on new parents and infants. Some parents say that COVID-19 has made them anxious about bringing their new babies out in public, so they just haven't, and also the fear of the risks of exposing them to the virus. Here with some advice is Dr. Miller Shivers, a psychologist and director of Our Little Ones program at Lurie Children's Hospital of Chicago. Appreciate your time tonight, doctor.
Thank you. Thank you for having me.
Such an important topic and challenge that so many parents have faced in the last year, new parents with their infants at home. I want to talk about the COVID risks, but also the social developmental aspects of this as well. So let's start with COVID. What are the risks for new babies in terms of being around adults who haven't been vaccinated and kids who are not able to be vaccinated?
Well, I mean, I think it's the same as the risk, for all people that have to be around people that haven't been vaccinated. But, newborns are particularly susceptible. So I would say that especially babies that have been in the NICU or had an illness at birth are more susceptible because they just, they're more inclined to catch things than older kids or even adults.
So what do we know about how the virus impacts infants and babies in those first months if they contract it?
Well, I think I don't know that they have had any. There's been any sort of press or anything in the out in the world that newborn babies have had COVID.
None?
Not that I'm aware of. There might be some, but
that would surprise me. Well, what are you telling parents in terms of safely socializing and getting their kids out with these risks that we know about?
Well, I think for newborns, it's not really important for them to socialize so much. I think what's the most important thing for a newborn baby is to have sort of a safe and warm, consistent caregiver and someone who's interactive, a caregiver who's talking to them, holding them, interacting with them. But I think in turn, also, parents need to be available to do those things. And if you're a parent who is very lonely or isolated at home, especially during COVID, it's helpful for you to get out, walk around the neighborhood, socialize a little bit, safely, so that you feel better, so that you can be more available for your infant.
What do we know about the early years developmentally with isolation for kids in the first few months, even up to a year, when they're not outside, they're not seeing other babies, they're meeting their grandparents or family members over a Zoom, so they're having a lot more screen time than maybe they would normally, not in a pandemic. Do you have any reservations about the environment that kids are in that early stage right now and what parents can do to help safely resume some normal activities?
Right. Well, we know that socialization is good for everyone. And we've all been socializing on Zoom, but that, is sort of a poor substitute for really in-person socialization. So I think, I would be cautious about relying on Zoom, especially with infants. As we know, screen time is not really healthy or really recommended at all for kids under the age of 2. But I think, you can introduce them to your grandparents if it's a safe thing to do, if grandparents have been vaccinated, if you understand the health risks of your infant and the people that you're around. But I think you have to do it within your comfort level. And, I think if the weather's getting better, it's nice to go for a stroll, go to the park, do things outside where the risk is lower.
A lot of added challenges for new parents and new babies in this last year, and we're sort of learning as we go, but obviously understand concerns that parents have about the kids losing track of some of those developmental skills. But as you're saying, love and nurture go a long way. Doctor, appreciate your time tonight. Thank you.
Thank you.